what this means is it'll enhance the coordination of the international response, enhance the cooperation across different countries, and hopefully ensure that we can work together to tackle this really important global problem.
What jumped out yesterday from the Director General was a concern that if this virus lands in a country that doesn't have sufficient health resources, potentially the continent of Africa, then there could be a fairly significant problem. How do you prevent that from happening?
No, this is the really key thing. I mean, the important thing to really flag is at the moment, of course, the vast majority of the cases that we're seeing are seen in China, and China's undertaking monumental efforts to try and interrupt virus spread. But the rest of us in the globe need to be ready and prepared for seeing this virus. And as you mentioned earlier, a number of countries in Europe and elsewhere are already seeing exportations. And what's really key is that we are ready to pick up those cases early, to ensure that the cases are isolated and appropriately managed, and contacts are traced to really try and prevent onward transmission.
Doctor, what jumped out from a conversation we had with WHO earlier this week was that there were no calls for travel restrictions, that if you start to lock down borders, then people will find a way to move, and then suddenly you don't have them going through official channels. You can't take temperatures, you can't keep a track of this virus. However, if that's not the process for developed countries, what is? Because we saw in China a decision trying to keep some workers at home to stop the spread of viruses through workplaces. Would you be advocating for that in countries, even right here in Europe, that workers stay at home for a period of time?
No, we wouldn't certainly be advocating that. For countries, affected countries like obviously China at the moment, the measures they're taking is really around trying to reduce transmission by those types of measures. For countries elsewhere, as I say, the key thing is really picking up cases coming from affected areas at a very early stage, so that onward transmission can be detected and prevented. For the general population, it's really the important message is not to people not to panic, to reassure people. Of course, you've got all the normal measures that you do to reduce your risk of picking up coughs and colds, to make sure you wash your hands regularly, that you catch your coughs and sneezes, and just reduce the risk of just catching not only a wide range of different respiratory viruses.
What's the view on the ability of health authorities, even in developed markets? Right here in the UK, there have been concerns that NHS workers have been stretched over the flu season anyway, that something else like coronavirus would just be an extra stretch on resources, and maybe we wouldn't have the right response even right here in the UK with the quality of the health service. Are you concerned about Europe's response to coronavirus if it does spread rapidly?
We're at obviously a stage at the moment where things are currently this is an issue in China, and I think for other countries, what WHO are really messaging is to be ready, to prepare, to pick up cases early, and hopefully avoid a situation where we're going to get widespread dissemination in countries outside of China. Clearly, as we've seen in China, the healthcare service is busy, and so we can see that the potential impact of this virus if it spreads, and that's why it's so important that we support this kind of global effort to try and contain the virus and interrupt transmission.
Hi, I'm Joanna Bersecci, and thank you for watching. You can check out more of our videos by clicking on the boxes on the screen. And don't forget to subscribe to our channel for more from CNBC International. Thank you for watching.